Good afternoon, and thank you for joining us for today's Prevention Network member webinar. My name is Dawn, and I'll be helping out behind the scenes if anyone needs anything. Before we get started, I wanted to let you all know that today's presentation is being recorded, so we will have all participants muted. If you have a question of any kind, please use the Questions tab along the right side of your screen. If you're having any problems hearing the audio with your computer, select the microphone icon at the top right of your screen and switch to your phone. We'll have a question and answer session when the presentation is complete. If we can't get to your question during the webinar, we'll do our best to follow up with an email. Also, in the right sidebar, you'll find some related documents under the Handouts tab that can be downloaded. A recording of today's presentation, along with a follow-up survey, will be emailed to everyone who registered by tomorrow. Now I'll turn it over to Taylor McDonald, PCANC's Parent and Community Engagement Manager, with some announcements and an introduction to our speaker today.
Good afternoon, everyone, and thank you so much for joining our Prevention Network webinar today on the ECAP. I would like to announce some upcoming events at Prevent Child Abuse North Carolina. We are having our Connections Matter for Prevention, Prevent Child Abuse North Carolina 2019 Learning and Leadership Summit, March 5th through the 7th, 2019. Registration is now open. April is Child Abuse Prevention Month. Registration is now available for 2 upcoming February 2019 Prevention Network webinars as well. On February 13th, we will be having a webinar on the Family First Prevention Services Act. And on February 25th, we will be hosting a webinar for Thank Babies North Carolina. Information on these webinars will be detailed later in the webinar, and I will share these links via the chat box. These links will be mailed out to you all as well. Now I'm going to turn it over to our CEO, Sharon Hirsch.
Good afternoon. We're very excited this afternoon to have this webinar with Becky Blanchard with the Department of Health and Human Services about the Early Childhood Action Plan. Before I introduce her, I just want to give you a little bit of background about the plan and PCANC's involvement in it. The department was charged by Governor Roy Cooper through an executive order to spearhead the development of a statewide early childhood plan with support from the Early Childhood Advisory Council, other departments, and stakeholders across the state. The department has coordinated with a diverse group of over 350 people throughout 2018 to create a draft of the guiding principles, the vision, and goals of the action plan for feedback from the public. The department is going to continue to coordinate with the Early Childhood Advisory Council to connect with local communities across the state for in-person feedback dialogues coupled with feedback received online in order to make sure that the Early Childhood Action Plan truly belongs to all North Carolinians. Prevent Child Abuse North Carolina has been very actively involved in providing feedback in the initial development of the draft ECAP. And we're really encouraged to get you engaged in this process. It's an exciting time in North Carolina. There's an increased focus on the need to invest upstream in our youngest children. And we believe the ECAP is an opportunity to foster greater commitment to prevention so that we can build the safe, stable, nurturing relationships and environments that we know all children need. We're excited to welcome Becky today. So I want to give you a little bit of background about her. Becky is the Senior Early Childhood Policy Advisor for the Department of Health and Human Services. In this role, she works collaboratively with the leadership of the department, other state agencies, and organizations across North Carolina to develop and support statewide goals for early childhood. She's the lead on the state's Early Childhood Action Plan, and she also directs the state's Early Childhood Integrated Data System. Becky has been very busy the last couple of months pulling this plan together and engaging with stakeholders across the state. We're excited to welcome her, and I'm going to turn it over now to Becky. Thank you so much.
Absolutely. Thank you so much for that very kind introduction, Sharon, and thank you to your team for having me. Let's get my screen shared up here. Perfect, thanks. And hopefully everyone can see my screen now, and we should be ready to rock and roll. So Sharon and your team, let me know right now if you see any issues on your end.
Nope, everything looks great. Thank you, Becky.
Perfect. Well, thank you all so much for spending your post-lunch hour with me talking about North Carolina's Early Childhood Action Plan. As Sharon mentioned, I am the lead on this very exciting work, but just a tiny bit of background on me. I'm a former bilingual kindergarten teacher out in Texas. So I'm born and raised in Durham, and I'm a Duke alum. I was also an instructional coach, and then after that pivoted to policy and worked in the mayor's office of Chicago, where my colleagues, my former colleagues are, some of them are in City Hall right now, even though it's -22 without wind chill outside. So needless to say, I am so happy to be back in my home state of North Carolina, coming back here about a year ago to help lead this work in early childhood for the state. So with that said, let's get to it. Over our time together over the next hour, we'll dive into why should we even be talking about early childhood here in North Carolina? Why is our state really well positioned, and why is it urgent that we implement this early childhood action plan? We'll spend most of our time actually walking through the structure and basic content of the early childhood action plan, so that whether you have heard about it before, maybe you've provided feedback on the plan, that everyone on the line is able to get a high-level overview of the draft plan. And then we'll end on a call to action for all of you to stay tuned for more to come with the launch of the final plan in just a few more weeks. And then I know we'll do some Q&A at the end, and I am eagerly awaiting what I'm sure will be really just excellent questions, and can't wait to hear them. So, in case you're already not bought into the idea of state investment, local investment, a policy focus around our early childhood years, I'm going to make a couple of arguments on why you should care. And you probably already do, but we'll start with this lens. Just want to start with this quote from James Heckman, who is a Nobel laureate, and maybe you're familiar with his research, but he's done a lot of research on the return on investment in early childhood programs, and we'll come back to some of his work in a minute. But this quote, I think, just really sets the tone for a conversation around the Early Childhood Action Plan. He wrote, "The foundation for school, career, and life success is largely determined through the development of cognitive and character skills beginning in children's earliest years." We know that these years are critical, and we know that the first years of life in a child's development are just a period of a flurry of activity in terms of brain connections that are being formed. This graph that's up on the screen right now is a simplified look at the level of brain activity that is taking place and brain development that's taking place in different sectors of the brain in the first years of life. And I like to focus in on language development in particular because of my own background as a bilingual educator. Y'all know, I'm sure, that it is much easier for young children to learn a foreign language or a second language than it is for an adult to learn one. And we see that that's especially because in that first year of life, brain activity is happening so much in terms of kids processing what the sounds around them mean, and they're piecing together information on segmenting different sounds and different intonations and taking in information and then making meaning out of language. And then you also see that after that first year of life, those neural connections, those new synapses that are forming really taper off. And this is a normal process in brain development called pruning, where it's kind of a use it or lose it mentality. If all of those sounds and language you were taking in previously is no longer useful to you, you're going to prune away those synapses. So it just becomes harder to learn a language later in life. We see that it's obviously not only language development that's taking place early in the brain development of a young child, but also their sensory development or their higher cognitive functions. You see that self-regulation builds over time in how young kids are developing those skill sets. But all of these different areas of brain development all work together to form a foundation in a child's brain structure. And if the wrong kinds of elements are in that pivotal period of brain development, it can create a weak foundation for that child. It can actually alter the chemical structure of their brain on which further development builds. So we see the impact of adverse childhood experiences, or ACEs, that I'm sure many on this line are deeply familiar with. That's why they have such a profound impact on young children. Instances of abuse or neglect, or just general dysfunction in the household of a child when they are in those formative years of brain development can have a truly lasting impact. So we know we must be on the hook for intervening and creating stronger foundations for young children, because we want to create a very healthy foundation of brain development for them to build on. And if I haven't sold you yet on why early childhood interventions and why focusing on early childhood is important from a brain science perspective, let me get back to the economics argument from Dr. Heckman, whom I quoted at the beginning. This is just a stylized graph of what his research is, his most famous research is about, and really looks at the return on investment for whether that's a state government or a nonprofit or the private sector in investing in early childhood programs. And what this graph shows is there's a diminishing return to the investor over time the later those programs are implemented and invested in. So, takeaways from this graph are the earlier that you put forth a program to support outcomes for children, the earlier in their lives you do that, the bigger the return on investment you get. And according to Dr. Heckman's research and others, the return on investment for early childhood interventions is somewhere between 7 and 13%, which, in our unpredictable stock market is just not a bad investment at all. And just to define, when we say early childhood, what that means in the context of our statewide early childhood action plan. And for this conversation, we are talking about the birth to age 8 time frame, which is typically when a child reaches 3rd grade, is when they're 8. And so sometimes you hear early childhood and you think that means 0 to 5 or 0 to 3. And the way we're defining it is with this 3rd grade, year 8 benchmark, because we know that many outcomes, particularly grade level reading proficiency rates by the end of 3rd grade, are often predictors for future outcomes for a child long term. So that's the scope that this early childhood action plan is built around. Though I know that the Think Babies webinar was mentioned in one of these introduction slides, we know that there is a lot of energy in our state and nationally around the birth to age 3 year period in particular, because we know how much brain development is taking place in those fundamental years as well. But this action plan in our state is defining early childhood as ages 0 through 8. And the other thing that I wanted to highlight that will come up again when we talk about the structure of the early childhood action plan is when we say early childhood, many people's brains automatically think, oh, early childhood, that means pre-K. And even the other day over the holidays, my husband was introducing me to a cousin who my husband said, oh, this is my wife. She works in early childhood policy for North Carolina. And he said early childhood education policy for North Carolina. So he actually misrepresented what I do for a living. We had a nice conversation after that, because when we talk about early childhood policy, we mean more than just pre-K. We mean more than just education. We have to think about these 3 buckets of the health, the welfare, the physical safety of kids, and their early learning all together, all at the same time. And you'll see this wheel graphic here represented in just a minute when we're walking through the structure of the plan. So just wanted to define what early childhood means for our conversation and moving forward. In terms of why we are poised for the Early Childhood Action Plan in North Carolina, we have a rich history of leading our nation in our early childhood efforts in our state, in particular with regards to early childhood education. So whether that's through scholarships that support higher educational attainment of the early care and learning workforce, or creating and implementing the Smart Start Network, or being one of the first states to develop a quality rating and improvement system for our early care and learning programs. We have been leaders in the early education space in particular. We're also very lucky to have, especially over the past few years, a lot of time and energy and investment focused around how are we thinking strategically about early childhood across health, child welfare, and early learning. And on this slide, you'll see just a few different examples of different initiatives or commissions or plans that have been written. One I really want to most call attention to is the Pathways to Grade Level Reading Initiative by the North Carolina Early Childhood Foundation, where they have spent years convening stakeholder groups across the state and building out a very robust set of measures and frameworks. Without all of these organizations, especially the Pathways to Grade Level Reading work and the Perinatal Health Strategic Plan, we would not have such a strong foundation for our statewide Early Childhood Action Plan. So if you hear language as we walk through the plan that sounds familiar from some of these initiatives, that's intentional and by design. So we have been leaders in the early childhood space in North Carolina, but we also have a lot of work to do as a state. And it is because of the challenges that we still face that we know we have a lot of room to grow in terms of the outcomes that we want to see for young children in North Carolina. These stats here are just a few of why we need this early childhood action plan. Our disparities in infant mortality rates in our state are very striking and I would say disturbing. Our African American infant mortality rate is 2.5 times the rate of white births in our state, and some of the highest rates of infant mortality in the country. In terms of hunger that young children face in our state, about 1 in 5 children in our state face food insecurity or they go hungry. Among our children in our foster care system, half of North Carolina's children who are 6, 7, or 8 years old who are in the foster care system will have spent more than 980 days in the system before they are adopted. That is well over a third of their young lives. And then finally,
this is Taylor. I'm so sorry to interrupt you. You're doing a wonderful job. If you could please just minimize your sidebar up at the top. Our participants are able to see that over your wonderful slides. So if you could just please minimize that. Thank you so much. Sorry to interrupt you.
Not a problem. I'm trying to figure out how to do that. Socket. That makes it go there. Hi.
You can slide it to the side. Perfect.
I think I got it. How many smart women does it take to figure this out? Perfect. Thank you for that. And I'm so sorry for keeping that out there for that long. Oh my goodness gracious. Well, I'll just end on this last unacceptable stat for our state and one of the other reasons why we must take action for kids. Less than 40% of North Carolina's 4th graders read proficiently as a nationwide, nationally normed literacy assessment. So we have work to do as a state, and our early childhood action plan is one of the ways that we're aligning and we are seeking to take action across North Carolina. So what's in this plan? Well, this plan is revolving around a vision that I'm sure all of us can get behind of what we want to be true for young children in North Carolina. And our vision for North Carolina's kids is that all of our children will get a healthy start and will develop to their full potential in safe and nurturing families, schools, and communities. And to work toward that vision, we've built out the Early Childhood Action Plan in order to be able to get there. It's focused around changing outcomes for kids ages 0 through 8. And this plan started out as a departmental priority of Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services. And she had originally charged the department with building out an action plan, much like the opioid action plan that was created. And this early childhood is one of our top 3 priorities as a department, those being Medicaid transformation, combating the opioid crisis, and then early childhood. Then, when Roy Cooper, our governor, issued an executive order last summer, the scope of the plan was expanded at his direction to not just be amongst the levers that DHHS could pull to change outcomes for young children, but instead expanded the scope to what actions do we want to take, what goals do we want to set for all of North Carolina, and think about all of the different types of levers that we could pull. So we, as a department, have been collaborating with the Early Childhood Advisory Council to draft and ultimately share a final early childhood action plan. This plan builds on the foundation of early childhood leadership in North Carolina that I mentioned. So there is language that intentionally aligns around a common set of goals and measures that other initiatives have already put forward. You'll see some goals that might be taken verbatim from other plans, and all of that is by design. This plan is also intended to amplify great work already happening for young children across our state and really cast a spotlight on types of strategies and interventions that we know will change outcomes for kids in our state. And just very quickly, like I said, this started, the work on this plan started back in 2017. A draft was shared on November 1st. We got hundreds and hundreds of comments submitted. Over 1,000 different people were involved in the drafting and feedback process. We got many pieces of feedback from the Prevent Child Abuse community in particular, and a final plan will be shared at the end of February and will go live online along with an online dashboard of all the great measures and rich data that's in this plan. So what we'll walk through is a draft of that plan, and I'll walk through the structure of it, but just know that there might be a few different aspects of the plan that will change for the final plan that's launched in February. So what you're looking at and what we'll be walking through is the draft that was released for public comment. So the framework of the Early Childhood Action Plan builds as follows. We started with a set of guiding principles to identify what are our fundamental beliefs that we are using in the development and drafting of the plan and ultimately in the implementation of the plan. So for example, one of the guiding principles that's listed in the draft is that we must focus on alleviating inequity in order to ensure that all of North Carolina's children are able to reach their fullest potential. So that focus on inequity is one of our principal fundamental beliefs, and you'll see that reflected throughout the plan. Then we are building on a vision. I read that vision statement before, that we're doing this because we want outcomes to change for all of North Carolina's children. That vision encompasses those three buckets that we've been talking about that make up early childhood. The vision around health, child well-being, and early learning altogether. Our goals in the plan are our 10 prioritized goals where we believe as a state that focused measurement and effort is needed in order to change outcomes for kids. We could have set 100 different goals in this plan, but the process of prioritizing those goals into just focusing on 10 is important in order to be able to elevate areas where urgent action is needed. Each goal then has a commitment or a broad aspirational goal of what we want to be true for children in that topic area. And then our targets and our metrics are what I think really make this plan stand out from other early childhood work in North Carolina or nationally. Not only have we set a strong vision for what we want to be true for kids in our vision statement and our beliefs and our commitments, but we're also demonstrating how we are holding ourselves accountable to reaching those outcomes, to reaching our goals. So we've set specific targets or 2025, so medium term, let's say, goals or data points that we want to be able to hit. And then our metrics are our annual measures that we'll track on an ongoing basis to see that we are, if we need to adjust course in order to hit our 2025 targets. And I just have a little call out box here to some phrasing that I think is very important. I tend to say that this is a data-informed plan as opposed to a data-driven plan. And as someone who loves data, and again, I also direct our early childhood integrated data system, as we mentioned, I think it is important to remember the limitations of any data that are used to inform action or policy making. That yes, we have to use data as one of our pieces of information, but we also must think about the context and collection methods of those data, and to what extent they can or cannot tell us information. So for example, in the aggregation process of over 40 different measures that'll go live on this dashboard we talked about, for the Early Childhood Action Plan, we're really thinking critically about how racial bias may or may not play into certain measures, particularly around our safe and nurtured goals. And I can talk about those in a little more depth, but we need to be critical consumers of data. So I tend to call this plan a data-informed plan as opposed to data-driven. So up until this point in our framework, we've defined what all the problems are, the challenges that we have that we're going to change outcomes on for North Carolina's kids. Our strategies and our actions we'll talk about at the end, but that's what we're going to do in service of reaching these goals. And then, as I mentioned, we'll be charting our progress toward our goals on our annual data dashboard. So I told you that wheel graphic would be back. As I mentioned, our plan is structured according to those three buckets of healthy, safe and nurtured, and learning and ready to succeed. Those all correlate back to the three different categories and buckets of our vision of what we want to be true for all kids. And so you'll see that each of these categories has at least three different goals associated with it. And what we do need to keep in mind is that any one of these goals, reaching it, would inform or impact being able to reach other goals. And what I mean by that is, for example, in my kindergarten classroom, I know that I could have focused all day on literacy exercises and teaching my kids to read. But if my students were coming into my classroom hungry, or they were unable to focus because they had headaches due to poor dental care, it didn't matter how great my literacy instruction was. We probably weren't going to hit our outcomes for the day. So we have to think together about health and early learning goals and safe and nurtured goals. And so you'll actually see that in the graphic structure, this cool ombre effect around the wheel of those colors blending together. That's exactly what this plan graphic is supposed to tell us. We need all of these goals all at once to change outcomes for kids. So with that said, let me walk through the goals of the plan at a high level. I'm going to walk through the first one in more detail so you can see the structure of how each goal is laid out. But I'll pull back and do a higher level overview of the goals in the plan after that. So the first section in the plan is our healthy section. Our vision for the health of children is that children are healthy at birth and thrive in environments that support their optimal health and well-being. And there are three different goals in the healthy section of the Early Childhood Action Plan. The first goal is called Healthy Babies. In the drafting process, we heard feedback from hundreds of stakeholders, but we heard specific feedback that all of our goals should be framed positively about what we want to be true for kids. So this is a goal about infant mortality rates in North Carolina, particularly disparities in those rates, as we mentioned earlier. But this goal is called Healthy Babies. That's what we want to be true for all babies born in North Carolina. Our commitment that I mentioned is that broad aspirational goal of what we want to be true and what we want to work toward under this goal. So for this one, it's North Carolina will work to decrease disparities in infant mortality, thereby improving overall birth outcomes for all children. Then we move into the one way that we're going to measure that broad aspirational commitment in this goal, or our 2025 target. For this goal, it's by 2025, decrease the statewide infant mortality disparity ratio from 2.5 to 1.92. And those are from data provided by the State Center for Health Statistics. Just to provide a little background into why we chose to focus on disparity, the disparity ratio in this goal, there was some discussion amongst our work groups about, okay, should we just set an overarching goal around reducing our infant mortality rate as a state? I believe it's 7.92 per 1,000 births, and just set an overall average decrease. But that rate reduction wouldn't tell the whole story about what's happening in North Carolina and the disparities that we see between African American births and white births, that stat that I mentioned earlier. So we decided in the drafting process, and we've gotten positive feedback about this choice, that really highlighting reducing the disparity in particular was critical in this plan. And then, as I mentioned, we're not only tracking that 2025 target of the outcome we're changing in the medium term, but we're also looking at annual benchmarks that are affiliated or related to that goal target. So some of those, for example, are percent of infants who are ever breastfed, because we know that breastfeeding is often an indicator of the health of a young child, for example. So each of these annual metrics will also be tracked in an ongoing way in order to track our progress toward the goal. So that's the Healthy Babies goal, just to provide some a deeper dive into the structure of each of the goals. I'll go through the other goals at a higher level here. Our second goal in the plan is access to preventive health services. This is a goal focused around ensuring that kids are receiving on-time, high-quality health care from a young age. And our measurement is focused on Medicaid recipients because we knew we had a strong data source on that. And our third goal is focused around food security rates, which is a stat that I mentioned at the beginning of the presentation, but that we're working on reducing, must work to reduce the rate of food insecurity among children in North Carolina. So that's the first section of the plan, the healthy section. The safe and nurtured section is the bulkiest section of the plan. It has 4 different goals under it. But this section, this part of our vision is children will grow confident, resilient, and independent in safe, stable, and nurturing families, schools, and communities. And so, as I mentioned, there are 4 different goals under this category of the plan. The first of those goals is safe and secure housing. We heard loud and clear from advocates that early on in the drafting process that there needed to be more of a discussion around rates of homelessness among young children, and a discussion around the physical safety and well-being of young children in their home environment. So this goal really focuses around those areas of concern. Aspects of data that we were able to collect for the final version of the plan, you're going to see just a couple tweaks to this one, but we're very pleased, and we've gotten very positive feedback about including a goal on homelessness and housing security for young children in the plan. Our 5th goal is safe and nurturing relationships. This is a goal that's focused around reducing child maltreatment rates in North Carolina, and these targets were set around subdividing into different age ranges for young kids, and that is setting a 10% decrease all around to reducing these rates of maltreatment. This is one of the particular data points that I think is important to highlight, that feedback we've gotten from our community stakeholders is potential inherent bias rooted in the reporting process of child maltreatment rates, and that we know that African American families are disproportionately reported for child maltreatment in North Carolina. And so this is an example of keeping in mind the limitations of the data that we're collecting. And our goal number 6 is related to that statistic that I cited earlier about the number of days that it takes for a child in the foster care system to be either reunified with their birth family or placed into adoption, but that this is a goal around ensuring that young children in the system are receiving that stability at a faster pace. In terms of the comments that I've gotten when meeting with stakeholders across our state, I'd say this goal and that statistic about over 980 days in the system prior to adoption or reunification. This is a constant point of discussion and questions that come up. So I know that these data are of particular concern to communities across our state. And I know that folks are pleased to see this being addressed in the plan. Goal number 7 is different from every other goal in the plan in that it does not have a data source. So goal 7 is social emotional well-being and resilience. We know that because of the fundamental period of brain development happening in early childhood, that a child's ability to be socially and emotionally well and resilient through challenging situations is absolutely fundamental to their development long term. What we don't have a good sense of yet is how to be able to measure that on a population level. And many states are asking this exact same question. How do we know that our young children are socially, emotionally well? There are some examples of measures of this, whether it's through screening tools of talking to parents of young children in the pediatrician's office, or different types of evaluations that teachers could do. But our target for this, our 2025 target, is that by 2025, we will have a population level measure for social, emotional health, well-being, and resilience of young children. And the reason why we've chosen to keep this goal in the plan, even though it does not have a data source, is that we as North Carolinians, we want to be a leader nationally in driving towards an answer to this question. How are we ensuring that our young children are developing their social, emotional well-being from an early age? And how are we, as their adult caregivers or child care providers or whoever, how are we thinking about that as a state? Our last section of the Early Childhood Action Plan is Learning and Ready to Succeed. And this part of our vision is that children experience the conditions that they need to build strong brain architecture and school readiness skills that support their success in school and in life. There are 3 different goals in this section of the plan. And the first goal here is access to high-quality early learning programs. This is modeled after the earlier goal around access to high-quality healthcare services. Similarly, we need to ensure that more children who are eligible based on income for high-quality early child care and learning programs, that they're enrolled into those programs. But then the second part of this goal is that not only are more eligible children enrolled, but that overall families are spending less of a percentage of their overall income on high quality childcare, because we know that high quality childcare can cost the equivalent of a college tuition for families. So that's something that we must be prioritizing as a state. Our 9th goal is early development. In previous iterations of this goal, it was called kindergarten readiness. We've spent a lot of time thinking in our work groups and through feedback about what we really want to drive towards as a state, is thinking through not just that children are entering kindergarten ready, quote unquote, by whatever set of benchmarks that means, but we're thinking more holistically about our young children getting the supports that they need from an early age to succeed in the classroom and beyond, whether that's through early intervention services or other types of services that support young children's development holistically from a young age. This goal is looking at utilizing kindergarten entry assessment data that comes from an assessment that is given to all entering kindergartners in North Carolina public schools and is administered by their teachers. So we are collaborating with the Department of Public Instruction to think about how could we utilize that assessment data in service of a goal like this, and in thinking holistically about young children's development in how they arrive in the classroom by kindergarten. And then the last goal in the plan is grade level reading. This is focusing on ensuring that more children in the 3rd grade are able to read at a proficient level. We know that with recent news around the Read to Achieve program in North Carolina, and that it was not able to reach the results that we wanted it to as a state, But when we're thinking about reading proficiency, we can't just think about educational outcomes in a silo, but that all of the goals of the plan up until this one all contribute to kids having academic success in the classroom, whether that's reading proficiency or other outcomes measures. So this goal we've highlighted in the plan as a major priority, but we also know that it can't exist without the support of the other goals in the plan. Okay, so we've walked through all of the 10 goals of the Early Childhood Action Plan. And in terms of our framework, we've gone through all of the goals and the priorities that we've set as a state of outcomes that we want to see be changed for young children in North Carolina. What we haven't talked about yet is the type of strategic intervention and action that it's going to take in order to reach those 2025 targets and work towards those aspirational commitments that we have put forth in this plan. So the rest of our framework is focused around how we get there. The way the plan was released in November did not include strategies, examples of strategies, nor examples of actions, though there was a high-level document circulated among our work groups and different stakeholder groups on ideas for the types of strategies that can be taken among leaders or local community members across our state to reach these goals. That document is called our Strategies Roadmap. So that is a draft of ideas for strategies. In terms of our framework and what will be released on February 27th, the plan will include not only those 10 goals and an explanation around our priorities, but it will also include this suggestion of high-level strategies that anyone across the state can look to for ideas for how to take specific and measurable actions. What you will not see in the plan, and this is by design, is you will not see any state-directed action that a local agency or a local county or state agency, rather, needs to take in order to reach our goals. As a state, we have to think about ground-up actions that all of us can take, whether you are a small business owner in Buncombe County or you are a leader in the Department of Public Instruction. It can run the gamut here, but all of us have a role in taking action for young children. So what you'll see in the plan and in the high-level strategies that I'm about to click through pretty quickly, you'll see some overarching suggestions of the types of strategies we need to implement as a state. And what I hope that you, if you're looking at the slides that I'm scrolling through or you're listening, I hope that you're able to hear, you as an individual, something that you can take action on. What we'll ask as the plan is shared will be at the end of February. The plan will come out with a set of high-level strategies for guiding ideas that anyone can look to. And we'll also share our DHHS department commitments to actions. What specifically are we doing in service of this plan? Our hope then is that the rest of the state, individuals, agencies, organizations, will also ask themselves and will publicly commit to taking action in service of young children, and that you'll be able to post those actions on our website. So as you're listening to these ideas, hopefully some of them are getting you excited about the types of interventions that you could take part in. So some of the ideas for how we reach these outcomes. Let's start with this one. At the end of the day, we must build and sustain strong relationships between young children and their families. That without that fundamental relationship unit for young children and a trusted adult or a group of trusted adults in their lives, that these goals can't be reached. So whether that's through evidence-based two-generation interventions like home visiting services, or that we are ensuring that we are tracking postpartum depression throughout the Medicaid transformation process, or that we are improving our reunification and adoption processes for children in our foster care system. Interventions like those that are all in service of building strong relationships between kids and adults is one category of the types of strategies that we need to see as a state in order to drive towards these outcomes. Another bucket of strategies is promoting supportive, productive, and equitable early learning environments. How are we ensuring that our early learning environments are free from cultural and systemic bias for vulnerable children? And how are our young children with disabilities, to what extent are they being provided learning supports to be able to meet their unique individual needs in the classroom? We also have to work to increase the rigor of our birth to third grade teacher and administrative preparation programs so that our classroom leaders are well informed in best practices for young children. Similarly here, our third bucket of strategies is support the preparation, compensation, and retention of the early care and learning and early elementary education workforce. I was a teacher. I know teachers are not as well paid as they should be. I heard a statistic earlier today from one of my colleagues that on average, a Bojangles employee in North Carolina makes a higher hourly wage than an early care and learning teacher in our state. So I think that's a pretty profound statistic that on average, an early childhood educator in North Carolina makes about $10 per hour. We must compensate our early care and learning professionals better if we want to ensure high quality instruction for our kids. Similar vein, our fourth category of the types of strategies we can take as a state are make early care and learning programs more accessible for vulnerable families. So this ties in line directly with our goal around increasing access to high quality learning. But one strategy in particular is how are we increasing access to childcare subsidies or other methods for outreach to vulnerable communities to ensure their enrollment in these programs. The fifth bucket of strategies is to integrate the support of children's social emotional development into early childhood services. So how are we using an evidence-based approach in best practices around social emotional health and well-being of kids into professional trainings for, that could be early care and education workers, that could even be, take this to another angle, imagine a world where our law enforcement officers were trained in the best social emotional development practices for early childhood and that they know evidence-based strategies for how to interact with young children. There's a lot of different types of actions that could be taken based on these ideas for strategies. Number 6 is improve economic opportunities for all families with young children. Providing a little background here, the only annual metric that's repeated in any of the goals in the Early Childhood Action Plan is tracking poverty rates of families with young children in North Carolina. We know that poverty and the experiences of poverty are indicators in all of these goals outlined in the plan, and that if we're not doing more strategically as a state to improve economic opportunities for all families with young children, then we are really going to struggle to hit the outcomes that we want to see change by 2025. The bucket of strategies, the 7th one, we have 10 of these, by the way, so 10 goals, 10 buckets of strategies, to be a little confusing, is prioritize racial equity, cultural competence, and family engagement in child and family systems. These categories of strategies revolve around how are we being inclusive in our policy-making process to ensure that there are seats for families of color around the table when decisions are being made for those families. Another strategy highlighted here is that we are working to eliminate or minimize the use of suspension and expulsion in birth through third grade classrooms because those practices are often rooted in racial bias, or that we are working to retain a diverse workforce of folks that work with young children. Number 8 is increase access to high quality health care for vulnerable young children and their families. This also falls parallel to our second goal in the plan about increasing access to health care. But one big strategy here is that we close the coverage gap or promote Medicaid expansion for low-income adults, which will ensure better regular access to healthcare. That creates a more stable home environment for young children. That will also create healthier births for young mothers who are now able to access healthcare, whereas they might have fallen into the coverage gap previously. Category 9 for strategies is promote healthy behaviors. This is a bucket that focuses on how are we creating environments across our state for families to have access to healthy foods in their neighborhoods or through their schools, and how are we promoting environments where physical activity is feasible and frequent, whether that's in the classroom, in our schools, or that's in the neighborhood, and how do we make those types of priorities for healthy behaviors accessible for families where a mom or a dad might be working multiple jobs and have long hours and feel like they can't promote the healthy behaviors that they'd want to. So how do we think strategically about those types of priorities as a state? And then the last bucket is a little bit different, but how do we, strategy bucket here is facilitate data sharing and collaboration to support data-informed decision-making. These ideas here are about the sharing of early childhood data in a more strategic way in order to inform policy practices for young children. So whether that's through the Medicaid transformation process, how are we prioritizing early childhood data and the health of young mothers' data in particular in that process is important. And then also, how are we thinking holistically about the data we do and do not have access to for as it pertains to young children's health, social emotional well-being, and early education. Okay, so we've walked through the plan as a whole, all of our 10 goals, where those goals came from. We've walked through a set of ideas of the types of strategies that it's going to take for us to get to the outcomes that we want to see by 2025. I want to close out before we open it up for questions with a call to action to all of you on the line. Now is the time to be thinking and taking action for young children in North Carolina. There has been a lot of news over the past few months and the past few years even on headlines around young children, whether that was the other week with the NIER report, NIEER, where CEOs from across North Carolina came together to advocate for changes in how we fund early childhood education through NC Pre-K in our state. I'm thinking about Governor Cooper's executive order earlier a few months back around how we support state employees who are pregnant with workplace accommodations to better serve them. I'm thinking about the entire Medicaid transformation process and the opportunities that opens for us to really prioritize young children. Thinking about our child welfare system and child welfare reform that will be taking place in North Carolina and the work already underway for that. And as I mentioned, our Read to Achieve headlines that came out a few weeks ago around really we need to do some innovative thinking on how we're serving young children in North Carolina. But in order to be able to do any of this, to reach these goals, we need your help and we need you to take action. DHHS is committing to the actions that we have within levers that we can control, but just those levers aren't going to get to all 10 of these goals. So be on the lookout for the final plan launching at the end of February 27th, or potentially a couple days before, we'll see. But we have a kickoff summit on February 27th where the governor will help launch our statewide early childhood action plan. And then over the course of 2019 and potentially into 2020, we'll be working to convene stakeholder groups across North Carolina to draft out local communities' commitments to taking action for young kids. After reading the Early Childhood Action Plan, how do you make meaning of it for your own communities? And what actions do you need to take? And how can we all work together to support each other? With that said, that is the end of the content that I've prepared in walking through the plan. But if you haven't gotten a chance to look through the full draft, I believe it's attached to various emails for this webinar. I think it's attached to this actual webinar somehow that you can click and get it. Otherwise, you can visit ncdhhs.gov/early-childhood, or you can Google North Carolina Early Childhood Action Plan, and you'll find the draft plan. And overall, there will be just minimal but important edits that will be taking place between now and the launch of the final plan at the end of February, based on the incredible feedback that we've gotten from all over the state and nationally. So I look forward to questions that y'all have, and we look forward to launching this action plan. Thank you.
Thank you so much, Becky. We greatly appreciate you talking about the ECAP with us today over that wonderful webinar. If you could please reshare your screen so I can pop up my end. Thank you so much. I greatly appreciate it.
I think I'm doing it.
Yes. Wonderful. All right. Thank you again so much. And can you all see my questions screen? Let me see. Hold on one moment. I'm sorry. All right, thank you all so much. Now I'm going to quickly go over some of the amazing questions we were asked today. The first question we got is, can you please share more about how the plan will be updated with us, Becky?
Absolutely. I think this is a really important question, especially going back to that data-informed versus data-driven point that I was making at the beginning. So the vision right now is that the data pieces of the plan will be examined and updated through some kind of a report on an annual basis. So we'll reevaluate, do these data points still make sense? Do we have better data measures for various goals in the plan next year or the year after that? In terms of updating the entire plan, we haven't set a strict set of timelines on that. Like, we're not committing necessarily to updating the entire plan every other year, for example, but there will be ongoing updates. This has to be a living, breathing plan. And I'm thinking in particular about posting commitments to action from across the state online is one way that this plan has to be living and breathing and changing constantly.
Perfect. Thank you so much for the answer to that question, Becky. The second question I have for you today is, who are the current ECAP partners that you all are working with right now?
Interesting question on how we define that. So there were, we convened a set of work groups of over 70 different people who represent a variety of different organizations. I don't have that list in front of me, but dozens of different organizations ranging from experts in early childhood health, child welfare, and early learning, practitioners in those spaces. So if we want to define partners as in terms of, who is a part of those work groups, I guess we could define it that way. But I'm thinking more broadly that there has been such a broad cross-sector of people and groups that have provided feedback on the plan, that have hosted either webinars or in-person feedback sessions or dialogue sessions on the plan. I will say that in terms of fundamental work that the plan is based off of, I come back to the North Carolina Early Childhood Foundation and the Pathways to Grade Level Reading Initiative, that without the strong foundation that they put forth in years of effort into those measures, our plan wouldn't be in the place it is today without their work. And then I'm thinking about the Think Babies work that's taking place in North Carolina and all of the different advocates partnering together in that work, that they're a big partner. So I would say that those are the two biggest groups involved, but we haven't defined specific official partners because this is such collective work.
Thank you so much for the answer to that question, Becky. And just quickly to touch on the Think Babies work, Prevent Child Abuse will be having a Think Babies webinar coming up on February 25th. I have shared the links in the chat box below, and we will be sending out information regarding the Think Babies webinar in February today via your email. So please be on the lookout for that. One next question that I have for you is, can you please share more about how often this plan will be updated?
I think we already answered that one.
That's right. Thank you so much. Let's see, we're just scrolling through some more questions here. Can you please go over the February 27th launching of the plan again briefly?
Yes, and I'm not sure I totally heard what you said, but I think it was going over the February 27th launch. Is that correct?
Yes, ma'am. Thank you.
Yeah, so on February 27th, there is a summit that is being hosted in Raleigh to launch the plan, so kickstart the plan into action, where Governor Cooper will be speaking, and a variety of other different leaders will be speaking on the different components of the plan. That is also the day that the plan will go live on the DHHS website for anyone to be able to download and read. And that's also the day when our data dashboard will go live, so anyone can dig into these really exciting sets of indicators on child health, well-being, and early learning in North Carolina. I am not aware of a data dashboard like this one that's been put together by the state before in service of kids, specifically 0 through age 8. So that's really exciting. So that's all coming at the end of February.
Wow, that's great to hear. A lot of great stuff happening in February. Thank you so much for sharing that answer. We have another question from a participant, Steve Roman. He states that they use triple P in the school systems to reduce suspension rates as stated on category number 7. Have you considered requiring triple P seminars as part of the orientation of parents whose children are approved for NC pre-K as a proactive approach for successful parenting and education?
Hold on, I'm sorry, you're cutting in and out, and I'm trying to listen as hard as I can, but I'm really having trouble understanding.
No worries, I apologize. Steve Roman states that he uses triple P in the school systems to reduce suspension rates as stated on category number 7. Have you considered requiring triple P seminars as part of the orientation for the parents whose children are approved for the NC pre-K as a proactive approach for successful parenting and education support?
An important question, and it sounds like that could be a suggestion for an action that should be taken in service of this plan. So we've heard a variety of different ideas in convening groups across the state, bringing this plan to folks. And it strikes up ideas for people who say, ooh, this is reminding me of this parent education course that we do, or a variety of different ideas. I think that this sounds like something that could be aligned to the work of the action plan. But what we won't see in the action plan are specific actions that would be outside the scope of DHHS's commitments to action that we could make. That sounds like it might be something maybe that comes from, well, it actually depends. I might need to learn a little bit more about what it would take to implement that. But thank you so much for that suggestion.
Thank you so much for that wonderful answer. Our next question is, how do I talk to my mayor or members of my local county commissioners about this plan? Can I do something locally to get this type of thinking in front of my local leaders? What a fabulous question.
Yes, That sounds like a great idea. Would love to help however we can. I'm thinking about after the plan is launched, the types of resources we'll make available online to people just like you who want to host convenings around how your local community can take action. So one resource that we'll be providing is a condensed version of the action plan. We're calling it an executive summary that will be more like a 12-page document as opposed to, a 50-page document. So something that's a little more accessible, a little more open. We're also working on what kinds of slide decks or PowerPoint materials that we could make available on the website. But we want to be as much of a resource as we can possibly be in helping support you locally to host convenings and conversations around early childhood. Let's keep in touch about that.
Yes, thank you so much, Becky. That would be very helpful to me and for all of us at TCAMC regarding the child abuse prevention plans in the community. So yes, let's keep in touch. And this is one last question for today. Will the strategy around data sharing help local agencies address the current barriers that exist around sharing data?
Another important question too. So what I can speak to is at a higher level, our data priorities as a state when it comes to early childhood data. So I mentioned that I direct our early childhood integrated data system. So we're thinking we are spending 2019 reevaluating the structure of that data system and to what extent it is meeting the needs of users across our state, whether those are state level users or local users, to be able to get early childhood data that they're seeking in order to be able to answer important policy questions, again, locally or statewide. And so we're reevaluating our own data system. My hope is that by setting priorities in the early childhood action plan through goals or through sharing ideas of strategies, that gives local communities or state agencies, anyone, a set of aligned priorities that they can use to generate their own ideas. So if local agencies are struggling with data sharing in particular ways, we've outlined that, you're right, as a priority area for a strategy. And I think that gives us all the impetus to be able to come together to talk more about what would need to change about our data systems locally to be better connected with one another. So it sounds like we're all getting aligned and that the early childhood action plan can help us do that aligning a little more efficiently.
Thank you so much, Becky, for the answer to that question and all of the wonderful questions that were asked today. Before we close out, I want to briefly remind everybody about 2 upcoming webinars that we have via the Prevention Network coming up in February. On February 13th from 11 a.m. to 12:15 p.m., we have a webinar on the Family First Prevention Services Act legislation. And on February 25th from 11 a.m. to 12:15 p.m., we have a webinar focused on Thank Babies North Carolina Coalition and its policy agenda. We hope to virtually see you guys all at the 2 webinars upcoming in February. We will be sending out these links for you via email today for you to register, and please be on the lookout for them in your Prevention Network newsletter. And as a quick reminder, April is Child Abuse Prevention Month. We have plenty of pinwheel kits. If you're interested in ordering some, please check out our website at Prevent Child Abuse North Carolina. And again, thank you so much, Rebecca Blanchard, for being here with us today to talk to us about the Early Childhood Action Plan. And we are so thankful to have all of you as a part of our Prevention Network. Have a wonderful day, everyone.
We'll be sending the slides later.
Yes. I did not answer that question. That's the one thing I failed to do. But we are going to be sending out the
You can't do
slides.
both.
Yeah.
You can't present because you've got to be thinking of questions, like having
You have to do it.
the two of
Okay.
you in the room will be perfect because anything administratively Dawn can handle,
Okay.
and you can just focus on